Mason County Central is a melting pot. We just have all walks of life of kids here, and they all have different needs, and they're all a little bit different. I'm getting goosebumps because I'm just having that moment of thinking, I'll do whatever I can to help kids, and I'll try anything that I believe will help kids.
The community that we serve within the West is about 13 counties, but today we're sitting in Mason County, which is kind of fun for me because this is actually hometown. So much of this work originally rooted from the Community Health Needs Assessment and the data that we found there. But what we really kind of discovered when we started to peel that back is we know access is an issue, we know mental health is an issue, we know that we find higher prevalence in our youth and our adolescents, but we saw some interesting data in there that also kind of called out as a community we were not really coordinating.
On the behavioral health front, we noted how isolated people were becoming, and it was getting very marked in our teenage groups of people. So we focused on getting together with the different high school systems, basically, that we have in our county to see if anyone wanted to partner with us to bring some sort of behavioral health care into their doors. We didn't know what that was going to be at the time.
At first, the purpose of bringing Corewell in was just the behavioral mental health and making sure we had some therapeutic options for our students. And at first, we talked about, would the students accept virtual? Tossed around all different types of ideas, and we settled on our high school. We're seeing between 15 and 20% of students at our high school are coming in for behavioral mental health.
And the kids were, what we found, they're very open to speaking to somebody. They were talking, telling us too, you need to open more spots because I have friends that need to get in too.
Not only were our kids suffering, but our families were suffering too, and things. There was a big reach out for that. Having Corewell step up and say, we have a model that might work. Will you partner with us? We said, heck yes, let's do this, because we knew we needed it. We've got some kids that have some big needs.
So Corewell really does have a clinic embedded in the high school, and that really helps us mitigate some of those access barriers because it'll meet students where they're at and also really get them into our system, which can help us kind of connect them with other resources if appropriate, which we often find. We find that we have students and families who are often underinsured, sometimes uninsured, and we might be their first true stop interfacing with healthcare.
The key to success is having that collaboration and that partnership with the school. Having that partnership means that we can identify students, what they need, where they need it. We can deal with anxiety, depression. We see a lot of our juniors and seniors as they're thinking about, what do I need to do next? And getting that support is sometimes just the additional thing that they need.
We started this in one rural area, and it is now expanded to 18 schools, and I have, schools reaching out pretty regularly to ask for it. There's so much more that a community needs beyond what is served in the hospital. And as healthcare providers, we're responsible to make sure those needs are met. In the most broad sense, that's what's important to me, is that our families, our students, and our schools are seeing the benefit of this.
You hear the terms partnership or you hear the terms collaboration a lot, but I think that this really is an example where we are living that every day.
This is a way to help our kids and our families, give them another way to connect with the needs that they have. Our kids can stay in school, still continue to get those services. That's what's best for kids.